Good morning, everyone. I want to take a few minutes and go over what are some of the course objectives that we have for this week for pediatrics, but I also want to talk about some of your homework assignments. So now there are a lot of course objectives this week, and I want to explain what kind of each one of them really means so you guys can have a better understanding. To start off with, we have discuss the developmental stages of life, common growth and development patterns, along with hereditary, cultural, and environmental effects, and how they can influence behavior. So because we're talking about pediatrics, we're talking about what it looks like from birth to 17 years of age and how we kind of go through those stages, and what each one of those stages really means and how it can affect the childhood and the growth and development based upon how the child was grown up, what environment they were in. We want to also identify proper communication and adaptation techniques as it relates to patient diversity while displaying professionalism and maintaining a professional behavior. Now, this is both for your diversity course project, but also when we talk about pediatrics. We do not speak to pediatric patients the same way that we do adult patients. Just because they are small versions of adults doesn't mean that we talk to them that way. So we do want to make sure that we are learning how to speak to them correctly, as well as with your diversity scenario that you and your partner have started to put together. You want to learn how to communicate with that diversity issue and how we still do that while being professional. Explain how to overcome sensory and language barriers in patient care. With children, this is extremely important because they can't sometimes communicate what they're feeling or what they're exposed to or what's going on in their minds. So you have to be able to allow some time to let the child play with some of the information or play with some of the equipment that you're going to be using. Show them that it's not painful. And again, watch for those language barriers, especially the nonverbal ones that your patient's going to give out. Administer an intramuscular, intradermal, or a subcutaneous injection. We'll be doing this with your your weekly skills check, and I'm going to try to make it as relevant to your patient's scenario as possible. Properly utilize the PDR, drug handbook, and other drug references to identify drug classifications, usual dosages, usual side effects, and contraindications. This will be important for your medication flashcards that you make each week based upon the medications on the scenario card, as well as help you better understand items and medications from your pharmacology assignment. Obtain all vital sign measurements on adult patients. Again, this will be with our weekly skills check, and that will include height, weight, blood pressure, pulse, temperature, respirations, SpO2, and LMP. Understand how to obtain an accurate height, weight, pulse, respiration, temperature, and both head and chest circumferences on a pediatric patient. This is different than what it is for an adult patient. So we have to learn how to do this a little bit differently and also learn how to adapt to do it for the child themselves. Analyze measurements results in order to understand the information and communicate abnormalities to the provider. So some of the things that we do, especially vital signs, are extremely important when it comes to pediatric patients, because if they're not growing or they're not gaining weight or if they've lost weight, it actually gives the provider a good insight to how that patient is doing in the home. So we really need to know how to watch for those different measurements and give the results correctly to the providers. Identify and aid in patient positioning. This sometimes can, especially for pediatric patients, what we're talking about here is more along the lines of what we need to do for certain injections, learning different holding techniques, helping mom or dad or guardian hold the child for immunizations, but also it could be for some procedures that we may do on a child. Perform selected CLIA-waived tests that assist with the diagnosis and treatment. For this week, we will be learning how to do a mono test, so I would recommend that you look up how that is done and also watch the weekly course procedure videos. Collect, label, and process specimens using various venipuncture and capillary techniques. You will be doing 2 capillary punctures this week. One will be for your diabetic glucose log with your patient, and the second one will be for that mono test. We will also do a weekly venipuncture check. Remember that at this point we should be able to have you draw either vacutainer method, syringe method, or butterfly method. Define quality assurance and quality control for laboratory tests and procedures. Remember that before you do any patient samples, quality control must be done. You have to make sure that the kit is accurately working before you can run any test samples. If it is not, then the test samples cannot be run. And lastly, describe common diseases, symptoms, and etiologies as they relate to meaningful use and pediatrics. So those are our course objectives. Let's take a minute and talk about homework. So the first thing on your assignment list is going to be your Module 6 discussion board. Remember, this is a case scenario, and you need to read the scenario and provide details on professionalism, attitude, time management, and hygiene as they relate to the scenario and the medical assistant. If you're reading through this and you do not think that something applies, then you simply need to state hygiene, or whatever the case might be, does not apply to the scenario. Your initial post is going to be due Tuesday by midnight, and they should be at least 100 words in length. And your reply post to a classmate should be at least 50 words in length, and those are due Saturday by midnight. Next on our list, we have our Mindtap assignments. Now this week you do have 3 assignments. You have chapters 41, and with that you have a reality check, and you also have a virtual lab on critical thinking and emotional social intelligence. You will also have your week 6 CMA prep. With the CMA prep, you do get 3 attempts to take that, and you can take it those 3 attempts. That is fine. The reality check and the virtual lab, you do get unlimited attempts. The Module 6 Path Assessment. This should be done after you do the Module 6 CMA prep. You should not be doing your path assessment before you do the CMA prep, because there is a question on the path form that asks how you did on your CMA prep, what areas were covered, and what you'll do to ensure that you understand this information moving forward. That will be due Sunday by midnight. Your Module 6 Pharmacology assignment will open Tuesday after class, and it will be open through Sunday at midnight. Again, you will have multiple attempts at this, but it is timed. You do have 120 minutes to take this. You have unlimited attempts, and it is 20 questions. And lastly, your Diversity Course Project Part 1 is due this weekend as well. Remember that your course, the Part 1, needs to be the template scenario that you would use to act out or role play the specific barrier that pertains to the diversity project you chose and you were approved for. I will not grade any partners until both or all partners have turned in their work. What I'm looking for is that you worked together and that your work is the same. Alright guys, that is what I have for course objectives and course homework this week. If you have any questions, please bring them to the lab on Tuesday. If not, I'll see you then. Bye everyone.